talk about the peripheral nervous system, which is made up of cranial nerves and spinal nerves, those coming off the brain and the spinal cord. We know, we've discussed before, that the peripheral nervous system could be divided into the somatic and the autonomic. Somatic controlling muscles and some glands, while the autonomic controls visceral functions. I won't walk you through this. We've done it before, but it's good for you to look at 11.8. So a peripheral nerve is surrounded by connective tissue layers in much the same way muscles were. We have endoneurium around individual nerves, perineurium around fascicles, which are also present in nerves as they was in muscles, and epineurium around the entire nerve itself. Sensory nerves take impulses into the brain or spinal cord, while motor nerves carry them away. Most nerves, however, are mixed nerves, which contain both sensory and motor fibers. And all of the spinal nerves, except for the first pair, are mixed nerves. The cranial and spinal nerves can be subdivided into general somatic or general visceral, and then they can be efferent or afferent fibers, depending on whether they are taking information to or from the central nervous system. The fact that they are called general has to do with the fact that they are not special senses, that they are controlling functions other than special senses like vision, hearing, taste, and balance. Those special fibers would then be called special somatic, efferent, or special visceral, afferent, visceral going to visceral organs, somatic going to muscles or glands, and the special somatic efferent would be muscles used in chewing, swallowing, speaking, and forming facial expressions, while visceral afferent would be impulses from olfactory and taste receptors. Special somatic afferent would carry impulses for receptors of sight, hearing, and equilibrium. So there are 12 pairs of cranial nerves. Most of them are mixed nerves. There are some sensory, and they are associated with special senses. Most are attached to the brainstem. There are only two exceptions. The first pair has fibers that start in the nasal cavity, and the second in the eyes. Cranial nerves are numbered 1 through 12. They also have names, and there are a lot of mnemonic devices out there that can help you remember those names if you look on the internet. The first one is the olfactory nerve. It is sensory only, associated with smell. It uses bipolar neurons, relatively rare. Comes through the cribriform plate of the ethmoid bone and goes into the olfactory bulbs. The optic nerve is number 2. It is sensory only. It's associated with vision, and its cell bodies originate in the retina and go through the optic foramina of the orbits. The eye is really an extension of your brain. The oculomotor nerve is primarily a motor nerve. That's number 3. It's voluntary muscles that raise the eyelids, move the eyes. Motor impulses to involuntary muscles that focus the lens and adjust the light entering the eye. There's also a small sensory component, proprioceptor fibers, so we know a position of our eye. Trochlear nerve is number 4. It's the smallest. It's primarily motor, works to move the eyes. Trigeminal has 3 parts. It's a mixed nerve. The 3 large branches are the ophthalmic, maxillary, and mandibular. The ophthalmic gives us sensory information from the surface of our eyes, our tear glands, our scalp, our forehead, and upper eyelids. The maxillary division is sensory from our upper teeth, upper gum, upper lip, palate, and skin of the face, while the mandibular is sensory from the scalp, skin of the jaw, lower teeth, lower gum, and lower lip. This also controls the muscles of mastication or chewing. The abducens is number 6. It's primarily a motor nerve, moves one of the pairs of muscles that move the eye. Facial nerve 7 is a mixed nerve. It has sensory from taste receptors to and motor to muscles of facial expression, tear glands, and salivary glands. Vestibular ocular nerve is number 8. It's acoustic, also referred to as the acoustic or auditory nerve. It has two branches, the vestibular branch and the cochlear branch. The vestibular is for equilibrium, while the cochlear is for hearing. The glossopharyngeal nerve, number 9, is a mixed nerve. It's got sensory from the pharynx, tonsils, and part of the tongue, and motor to salivary glands and muscles of the pharynx for swallowing. Vagus nerve 10 is a mixed nerve. It's somatic to motor to muscles of speech and swallowing, autonomic to heart, other viscera of the thorax and abdomen. In fact, the vagus nerve is the only one of the cranial nerves that leaves the head and neck region and goes into the major part of the body. It also has sensory from our pharynx, larynx, esophagus, and the viscera of the thorax and abdomen. The accessory nerve, number 11, is primarily a motor nerve. It used to be called the spinal accessory nerve. It's got two branches, a cranial branch and the spinal branch. Hypoglossal nerve, number 12, is primarily motor. It's motor to muscles of the tongue, used for speaking, chewing, swallowing. And here is a table, table 11.9, that goes through each of those. Good for you to go through, good for you to use that for review. And there's the rest of them. The spinal nerves are all mixed nerves except for the first pair. Those are purely motor. They originate from the spinal cord. There are 31 of them, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. And then at the very bottom, there's a structure called the quadra equina, which is the descending roots of the lumbar, sacral, and coccygeal nerves. So we look at the spinal nerves. Each one splits into a dorsal and ventral root inside the vertebral column. That dorsal root or posterior root is a sensory root, contains cell bodies of sensory neurons whose axons are conducting impulses from the peripheral of the body to the spinal cord. A dermatome is an area of skin that is innervated by a sensory nerve fiber from a specific spinal nerve, and that can help you to assess damage to spinal nerves. The anterior or ventral root is a motor root. It has the axons of motor neurons where cell bodies are in the spinal cord. The spinal nerve is the union of the anterior and posterior roots, making it a mixed nerve, and branches of those spinal nerves outside the spinal cord would include meningeal branch, posterior branch or ramus, anterior branch or ramus, and visceral branch. The visceral branch is only in the thoracic and lumbar regions. A plexus is a complex network formed by the anterior branches of the spinal nerves, not in T2 through T12, in the anterior rami of the intercostal nerves, of various fibers of spinal nerves assorted and recombined so the fibers heading to the same peripheral body part reach the same nerve. There are 3 major nerve plexuses, the cervical, brachial, and lumbosacral. The cervical is formed by the anterior rami of C1 through C4. Deep in the neck supplies the muscles of the skin and neck. C3, 4, 5 roots contribute to the phrenic nerves, which transmit impulses to the diaphragm. The brachial plexus is formed by the anterior branches of C5 through T1. Deep within the shoulders, it has 5 major branches: the musculocutaneous nerve, the ulnar and medial nerves, the radial nerves, and the axillary nerves. The lumbosacral plexus is formed from the anterior branches of L1 through S4, and it's in the lumbar regions of the abdomen, sacral portions of the pelvic cavity. It has the obturator nerve, the femoral nerve, and the sciatic nerve. Spinal cord injuries can be caused by the process of being born, the dislocations, vertebral fractures, other penetrating wounds, gunshot wounds, pressure from tumors, Whiplash is a sudden bending of the neck, compressing the cervical plexus nerves that leads to persistent headache, pain in the neck. Broken or dislocated vertebrae in the neck can sever or damage axons to the phrenic nerve, which can result in paralysis of the diaphragm. Thoracic outlet syndrome is pressure on the brachial plexus due to continuous flexion of the arm. If you're a painter, for example, or typist, that can result in pain in the neck, shoulder, and upper limbs. Sciatica is a compression of the intervertebral discs in the lumbar region, which results in pain in the lower back, the gluteal region, even down to the thigh, calf, and foot. And carpal tunnel syndrome is a repeated movement injury that inflames the region known as the carpal tunnel, and the swelling compresses the median nerve, resulting in pain in the arm and wrist. All right, we'll stop it there.